All right, the COVID-19 pandemic. All right, we look at it now from the rearview mirror, but that does not mean that the World Health Organization has forgotten the unprecedented amount of power that nations willingly handed these so-called experts. And we all watched in shock as they did some of the things they did. Well, this coming Saturday, they're going to attempt to recover some of that unprecedented power. July 19th is the deadline for countries to reject the 2024 amendments to the World Health Organization's international health regulations. So what does all that mean? And probably more importantly, is there anything that can be done about it? Well, joining me now to discuss this is Frank Gaffney. He's the president of the Institute for America's Future, and he also is the host of Securing America, which is heard on Real America's Voice Network. Frank, welcome back to Washington Watch. It's an honor to have you, my friend.
Well, it's great to be with you, Congressman. Thank you so much.
Well, listen, I don't know of anyone who has kept up with this particular issue more than you. You and I have had multiple conversations about the power of the World Health Organization. So let me start with this question. Is the U.S. in any way a party to this international health regulations that WHO is in control of?
Well, it's a very important question, and I think it depends really on what is done by President Trump in the next 2 or 3 days. As things stand right now, under the Biden administration, which was only too happy to see global governance advocates like the World Health Organization, like the United Nations, like the World Economic Forum and associated multinational companies who have been driving this train that what we need is a new world order, one that is run by elites who are not accountable, who are not elected to rule us, but who will nonetheless have the authority to do so. They have, as a result of championing in the Biden years, something called the amendments to the international health regulations, which actually predate the creation of the World Health Organization. So the World Health Organization, is sort of the entity that applies them and implements them and so on. But the reason I'm going to make all this plain is that just because President Trump, to his great credit, has said we're getting out of the World Health Organization effective as soon as possible, which is January of next year, we will still be bound by these international health regulations and the amendments thereto that were adopted last year if he does not say we're out of that too. And so,
wow.
As you mentioned in your opening, it's critically important that the president take this action of formally notifying the UN, the World Health Organization, that we are not going to be bound by these amended health regulations, and for good reasons, Jody. They are very troubling on a couple of different scores, if you'd like to get into that piece.
Yeah, let's get into that. We've only got a couple of minutes left, but so we have till July 19th, this Saturday. If it does not happen, how would the United States be obligated? How would that impact our sovereignty or whatever else would be impacted?
Yeah. Well, there are basically 4 different ways. One is that the amendments transform the World Health Organization's Director General from a guy who provides, advice which nations can take or not take about so-called public health emergencies of international concern. It changes that into being able unilaterally to declare when one exists, and then to dictate what nations have to be about to do to implement his guidelines for addressing that public health emergency of international concern. So that's one way you would see a direct affront to our sovereignty. Another is that it talks about censorship arrangements. We saw a lot of that, as you were mentioning, in connection with COVID-19. That's an affront to our sovereignty and our personal freedoms if we're being told you can't say certain things because they don't conform to the dictates of the World Health Organization. Another is a sort of surveillance state quality. They want to create digital IDs for every man, woman, and child on the planet. And they want everybody, in the name of having the ability to monitor their health conditions, to provide intensive personal details about.
Frank, let me ask you this. What can our audience do to try to stop this power grab? We've got about 30 seconds.
Well, I'll just say the fourth thing is that there are also financial implications as well. We're going to have to spend money if we're told to do so. The bottom line is this. Get in touch with the White House. I believe the switchboard there is 202-456-1414, if I'm not mistaken. Please let President Trump know you want him to act to affirmatively reject these international health regulations and spare us the assault on our sovereignty and personal freedoms.
Now is the time to let your voice be heard. Frank Gaffney, president of the Institute for American Future, thank you so much for joining us. You've been on top of this issue for a long time. God bless you for it.